Hi, my name's Kirsten Eagles. My student number is T00698082. And today I am going to be going over the joint. So I have a knee joint here from a cow. I'm going to be going over the different parts of it. So we will start with some parts of the bone. So first we have the diaphysis. So the diaphysis is the shaft of the bone, so the longer part of the long bone. Then we have the epiphysis. So the epiphysis are the two either proximal or distal ends of the bone. So you would have the epiphysis right up here. Then we have the epiphyseal plate or the growth plate. So that you can see in both bones here. By this darker color, so that when the animal is younger would be cartilage and would grow with the animal. So you can see that this animal is fairly mature. There is still some red marrow in there, so probably around like 2 or 3 years old when it was slaughtered. Then we have the cortex or compact bone. So the compact bone makes up the outside of the diaphysis. So you can see it on either side here, and it makes up a thin layer of the epiphysis along the edge here. So that is the compact or cortex bone. Then we have a nutrient foramen. So I don't have one on this bone, but what a nutrient foramen is, it's a hole along the diaphysis that allows blood vessels through. So that allows nutrition, blood, oxygen, that sort of thing to get into the bone to allow those cells to grow and rebuild bone as needed. Then we have the medulla. So the medulla is the cavity within the bone. So the medulla actually holds the bone marrow. So it would be that cavity right in there. Then we have the cancellous or spongy bone. So that makes up the epiphysis part of the bone. So all of this bone here would be considered spongy bone. And we have the periosteum. So the periosteum is a membrane on the outside of the bone, and then you have the endosteum, which is the membrane on the inside of the bone. You have the bone marrow, so I've actually cut a piece out here. So the bone marrow is inside the diaphysis there. And then we have the joint capsule. So the joint capsule would, if we get this up here, would cover the entire joint. It would be like a membrane that covers the entire joint area here. There would be a synovial membrane. Now where this has been cut, it's a little hard to see, but there would be a membrane within that joint space that holds all of the synovial fluid. So again, there would be no fluid here now because it's cut, but the fluid would sit within that joint cavity to allow easier movement in the joint. Then we have the articular cartilage. So the articular cartilage is on the two epiphyses of the bones. That cartilage is what articulates with the other sides of the other ends of the bone. Hyaline cartilage is the same thing. It's that cartilage. It's what the articular cartilage is made of. Is hyaline cartilage. Then we have the meniscus. So the meniscus is this little half moon shaped fibrous cartilage right in here. So that supports the bone or the joint on the medial and lateral sides. Prevents the joint from slipping around. Then we have the medial and the lateral condyles. So if we put our joint together here and we flip to the caudal side of the femur, you can see the two condyles. You have medial and lateral. They are these parts right here. So those are the projections or condyles of the femur. And then we have the patella. So there actually isn't a patella on this with the way that it was cut. It was taken off, but the patella would be a small sesamoid bone that sits right in that patellar groove or trochlear groove. So it would sit within the patellar ligament. Then we have medial and lateral epicondyles. So going back to those two larger condyles, the epicondyles would be two smaller projections. So one would be here off of the medial. This one would be the lateral condyle, and then you would have the another epicondyle here, and that would be the medial epicondyle. Then we have the tibial crest. So if we get things figured out here. So the tibial crest would be the part of the tibia that follows along distally down this way. You can follow up and you would feel the tibial tuberosity right up here. The fibula would sit on the lateral side of the tibia. So lateral side, it would fit into this part right here. You would have a fibula. Then we have the anterior and posterior cruciate ligaments, also called the cranial and the caudal cruciate ligaments. So if you get a little bit closer here, you would have this one here would be the caudal cruciate ligament or posterior cruciate ligament, and in behind that, if we can get it here, you would have the anterior cruciate ligament or the cranial cruciate ligament. So those help to stabilize the joint as well and prevent the tibia and the fibia, or the fibia and the femur from sliding backwards and forwards. Then we have the medial and the the medial collateral ligament and the lateral collateral ligament. So those are on either side of the bone. On this side here, it's actually been cut, but it would be a ligament that connects down on the side here, and that would prevent the tibula and the femur from going sideways. And then we have the other one here. This one's actually intact. You can see it goes down that way right there. Then we have the patellar ligament. So with this one as well, the way that it was cut, the patellar ligament was actually removed. But it would go over and it would contain the patella and it would connect onto the tibia right here. You can see a piece of where it used to be. So it would connect from that point and come and cover the entire cranial portion of the joint there. Now, we're going to talk about the drawer test. So the drawer test is used by vets to determine whether or not there's a cruciate rupture. So a drawer test would be taking the knee or the stifle and pushing it back and forth to see if it moves in that drawer motion. If it's doing that, then you know that you have a rupture in the cruciate ligaments. And then the difference between human and veterinary nomenclature for the cruciate ligaments. So in humans, they are called anterior and posterior, and then in animals, they're called the cranial and the caudal. So for people, you would often hear people tearing their ACL or their anterior cruciate ligament, whereas dogs, we call it that cranial and caudal cruciate ligaments. So that is all of the parts of the bone. So thank you for watching today.